Hi everyone, and welcome to a video on when you put your jaw out. Now actually, when you put your jaw out, you're putting out your TMJ, which is your temporomandibular joint. Now this is located just in front of your ears, right here, and can be incredibly painful. And apparently this happens to quite a few head and neck cancer patients. It can give you pain in the muscles, nerves, and in the muscles over your head, which makes it incredibly difficult for eating, yawning, or doing anything where you have to open your mouth. I could hardly open my mouth for a period. Now, one of the problems I had, which I wasn't too happy about, I had to go back on puree. I just couldn't move my mouth very much and certainly couldn't chew. So it was puree, and you can imagine, after having had my cancer in 2019, I was not a happy bunny going back on puree. So I was determined to find a solution. So I asked my speech therapist and checked a few people, and so I'd like to share with you those exercises which helped me. Now, before you do any exercises, as I've told you before, do check with your doctor as to whether it's okay to do these. So before you even start doing the exercises, you need to warm up these muscles. Now there's two ways you can do it. You can get a warm flannel, face cloth, put it in hot water and then put it in a plastic bag and just put them at the sides of your face. Or you can massage backwards, forwards, and you can get in deep with your knuckles. Just warm up those muscles before you do the exercises. So the first exercise is a bit of resistance. Place your thumb under your chin, and you're going to open and close your mouth slowly, but you're going to resist it opening. So let's try a few opens and closing. Now you may find, like me, I could hardly open my mouth, but do it anyway and you'll find gradually you'll get more opening. The next one is to put your finger, make sure it's clean, on your bottom teeth. And again, open your mouth and close it, but resist. Now it's important to do these exercises slowly because it's the resistance which is going to help the muscles. Now for this exercise, again, make sure you've got clean hands. Put your finger in your mouth and keep your lips open, but close your teeth on your finger. And what I want you to do is open and close your teeth onto your finger, like this. And don't forget, in between each exercise, massage those muscles. Keep those muscles nice and warm. For this exercise, you're really going to try and mobilize your jaw. Now, if you're like me, you'll hardly be able to move it at first, but persevere. You will be able to get more movement the more you do it. Like any of the exercises I've shown you, the more you do it, the more freedom of movement that you'll get. So I want you to sit up straight, good posture, and I want you to, with your teeth apart, open your mouth just in a relaxed position. Now what you're going to do is move the bottom of your jaw to the left and then to the right. backwards and forwards for 8 times. So here we go. Relax. Now, you're going to feel a little stretch here in the TMJ. Massage it if it feels uncomfortable. Again, you can use the warm cloth to help relax it. So do it at least 8 times, 2 or 3 times a day. We're now going to do chin tucks. So sit up straight. Remember, I've always talked about having good posture. Sit up straight, breathe in, and push your chin back. I hate to say, almost make yourself have a double chin. So breathe in, hold it, and back. Breathe in, hold it for a few seconds, and back. And repeat 3 or 4 or 5 times. You're really trying to push your chin right back towards the back of your neck. One more time. Breathe in. And relax. Now for the next exercise, you're going to close your mouth with your teeth touching. You're going to put your tip of your tongue on the top of your palate or the roof of your mouth and try and push it back as far as you can. When you've done that, you're going to open your mouth. So close your mouth with your teeth together, tongue at the top of your mouth, and open. You're going to feel a real stretch underneath your tongue as you try to open your mouth. Well, thanks for watching. I hope the exercises have helped your TMJ, which is your temporomandibular joint. 1 or 2 things you might want to do until your joint gets back to normal, and that is avoid eating foods that are hard to chew or crunch. So don't try and crack a hard piece of chocolate because that's going to put your jaw out. And while you're sleeping, if you have a tendency to grind your teeth, it might be worth you getting a mouth guard. And if you're just sitting relaxed, try and keep your teeth apart. Just relax your mouth. Not that. So, good luck, and I look forward to seeing you on another video. And I hope you're recovering well. I have just passed 3 years, 9 months cancer-free, and I hope you're staying cancer-free. Bye-bye.